From painful kidney stones to life-saving transplant, let's know urology in depth. Are you ignoring your urine problems out of shyness? This interview might help you to protect your health and even can save your life. Are you above 50 and suffering from prostate? Well, prostates are common yet scary, but modern technologies, modern treatments makes it easier and even safer than ever, and we will talk about it. Are you a young dreamer and want to know how to become a urologist? Well, to know how to become a urologist, you have to watch our video till end. So hello, namaskar, I am Dhanmoy and I am privileged to host an enlightening and informative session on modern medicine, that is urology. As in Assamese, we say, Deha thakile hai beha. It is our health that matters the most. So to discuss about our health issues, to discuss about urology issues or urine issues, any problems regarding urology, we have Dr. Debanga Horma, an expert in urology. So sir, welcome to the show. Before we begin our today's program, sir, could you like to say something about yourself? And I want to know what inspires you or what makes you to choose this profession, to choose this line? So please.
Yeah, I am Dr. Debanga Sharma. Presently, I am working in Guwahati Medical College in the Department of Urology and Renal Transplant as the professor in that department. And I am also working in Metro Hospital. I am doing private practice here in Guwahati Metro Hospital. So if you ask me why I have chosen urology or the medical profession, there are two things. One is medical profession. I have chosen medical profession because I want to serve people. That is first thing. And in medical profession, why urology? Because kidney fascinates me.
Okay.
It's a very fascinating organ. So to treat the diseases of kidney, and that too surgically, it inspired me. It has got it interest. I got it interest in that. So I have chosen urology as the branch where I specialized in.
Okay. As nowadays we can see urine problems are very much common in today's in today's life, but people are I don't know, out of shyness or what, people are not at all loud, open up to speak about it. So I want to know in very simple language that, sir, what is the scope of urology and actually what comes under urology, or what are the problems regarding to urine people faces?
Yeah. If you say urology is synonym to urine problems, I would say it's not true, absolutely. Actually, it's a part, urine problem is a part of urology. So as a urologist, what we treat are the organs like kidneys, any diseases of the kidney where surgery is required, like most common is the kidney stone, then kidney cancers,
Okay.
then any problem that is happening in your ureters.
Okay.
In urinary bladder. So if there is a stone in urinary bladder, there is a tumor in urinary bladder, we treat it. So when you say that you have the problem of urinary problem that is related to urine, are most commonly from urinary bladder. But we have another part also. We do treat the diseases of male reproductive organs.
Okay.
All the cancers of those organs we treat. Even in females also we treat the problems of urinary bladder.
Okay.
And one of the most common problem that most of the, as you have said, the urine problems, and that is more common in females. So the problem of urinary incontinence or involuntary passage of urine is more common in females that we treat.
Okay. सर, मैं अभी जानना चाहती हूँ कि पहला जो symptoms kidney stones का क्या होता है? Like people should take some precautions, right? बहुत बड़ा kidney stones होने से पहले तो क्या-क्या symptoms होता है जो people should take?
The most common symptoms, or if you say that what is the most common problem in kidney stone, is the pain.
Pain, okay.
And second things जो आपने पूछा है, तो कभी-कभी bleeding होता है in bladder, in urine, and third is fever. Fever is one of these three are the most common symptoms of urinary stones, any part of the urinary system.
Okay. तो उसका precautions क्या होता है और कैसे आप treatment क्या-क्या treatment होता है?
If you ask about the treatment of kidney stones, there are three type of treatments that we can do. What we
Without
do is
surgery possible हो सकता है क्या?
what we do is different. What are the procedures by which we can do are different. So what are the procedures that we can do, or all urologists are doing? First is open surgery. second is keyhole surgery, and third is endoscopic surgery.
Okay.
So one by one, if I come, open surgery, अगर आपको एक बड़ा incision, if we put a big incision in your body, which is very painful, वो open surgery है, and that we don't do nowadays. That is absolutely, we are not doing it. Second is keyhole surgery. So वहाँ पे हम लोग क्या करते हैं? We make a very small hole in your back.
Okay.
And the size of the hole is about that of a needle. So through that we remove the kidney stone with the help of laser.
Okay.
And third and the most advanced one is the endoscopic surgery, where we don't put any holes. कहीं हम लोग छेद करते ही नहीं है. So हम लोग क्या करते हैं? हम लोग पेशाब के रास्ते से जाते हैं. We put a endoscope and we remove the stone from the kidney with the help of laser without making any incision in your body. And that is the most advanced procedure of removing kidney stone, which is known as RIRS. That is, if I clarify it more, that is retrograde intrarenal surgery.
Okay. So आपने जो ये 3 टाइप्स का सर्जरी के बारे में आप अभी बोला, तो कितना एक्सट्रीम पॉइंट में होने से लाइक यू हैव टू डिफाइन दैट 3 सर्जरी, कौन सा टाइम में, कौन सा वक्त में क्या सर्जरी लेगा?
फर्स्ट इज ओपन सर्जरी हम लोग करते नहीं है, बिकॉज इट्स वेरी if I say it's very crude. In what sense? Because हम लोग बहुत बड़ा incision देते थे, मतलब patient को, the recovery of the patient is it's very painful while recovering. Second is, if the size of the stone is more than 2.5 centimeter, we do keyhole surgery. That means we make a hole, एक छेद करते हैं, एक like in that of a needle, and we remove the stone from the back. And if the size of the stone is less than 2.5 centimeter, we do it totally endoscopic. We can do the surgery in the morning, and in the evening he can go home and he can carry out his normal activities.
Okay. So sir, what is now laser surgery? People want to know about laser surgery.
Yeah, मैंने जो बोला था, I told 3 procedures. Open surgery we don't use laser. In keyhole surgery we use laser, where we break. Laser is nothing. It's an energy source by which we can break the kidney stones. Okay. So when we put a small we make a small hole in your back. We cannot remove a stone which is more than 2.5 centimeter through it. So we have to break it. How we break it? We break it through a laser fiber. The size of a laser fiber is that of a needle. So with the help of laser fiber, we break the stone and we bring it out. And in endoscopic surgery also, through the flexible endoscope, we break the stone, we make it like a powder, and we remove the stone. So it's a source of energy by which we break the stone, kidney stone, and we remove it.
Is it risky? I mean, is it comes between life and death in that
Actually, the thing is that, as I have told you, if we do a endoscopic laser surgery, in the morning we will do the surgery, the patient can go home in the evening, and he can carry out his normal activities.
Wow,
if he comes after, say if I do a surgery at 10 a.m., he can have his dinner in the home.
Okay. So people wants to know what actually laparoscopic surgery is in urology.
Yeah, laparoscopic surgery is a surgery where we do the surgeries with the help of long instruments and by making holes in your body. Like it's not for stone surgeries.
Okay.
First I want to make it clear, laparoscopic surgery, we cannot do a stone surgery with the help of laparoscope. So laparoscopic surgery comes when there are conditions like if the patient is having a kidney which is not working,
okay.
if the person is having a kidney which is having cancer. Okay. So previously what we do is that we make very big incisions and we remove the kidney through that. But nowadays, with the help of laparoscope and the skills that we attain from outside after getting trained, we can remove the kidney or a kidney cancer or a part of the kidney with the help of laparoscope. That means 3 holes we'll make. With those holes we'll put 3 instruments, and with the help of that we can remove the kidney or any disease that is related to kidneys, urinary bladder, which are not stones.
Okay. If you mentioned that you will remove the kidneys and all, but is it possible to deceased other person's organs and then put the kidneys to the patient, or who is suffering from kidneys too?
What you are asking about is regarding transplant, I guess.
Okay.
Yes, but transplant cannot be done laparoscopically.
Okay.
So in transplant, what we do is that if a person is having 2 kidneys which are not working, right? So we have 2 kidneys and that is not working. Then what are the options? Patient can go for dialysis, yes, but lifelong dialysis is again risky.
Okay.
So what we can do is that we have to do certain evaluation, we have to do certain matching, and one person, if the kidneys of that person is matching with that person, we can take the kidney from that person and put it on the other person whose both the kidneys are not working.
Okay.
So that is how we get the kidney. Is we can do it laparoscopically, that is known as laparoscopic donor nephrectomy. But when we put the kidneys, that cannot be done laparoscopically. That we have to do openly. Yeah.
Okay. We can see nowadays that people are suffering from prostate problems, and they are not even allowed to say about it. So, sir, would you like to say about prostate problems?
Yes.
Why does it happen, or what are the precautions, or what is the symptoms of it?
Okay. Prostate is a disease of males.
Okay.
That is an organ that remains. Many of us doesn't know that all males are having prostate, and females doesn't have. So any disease that is related to prostate will happen in males, and it is a disease of aging male. So a male who is more than 50 years, the prostate starts to enlarge. Normally it doesn't
Above
get
50
enlarged.
years.
Yes.
Okay.
But in some certain, if I say that if we consider the males as in 100%, then we can say that around 70% of the males will have symptoms because of prostate. Everyone is having prostate, but symptoms are because of the prostate. 70% will have that symptoms. So, because of the prostate, there are certain specific symptoms that happens in aging male. Like patient will have obstructive urinary stream, poor urinary stream. Patient may have bleeding. Patient may have recurrent fever because of urinary tract infection. So these are the symptoms of prostate, and it happens normally in a aging male who is more than 50 years of age.
Okay. So what is the precautions
there is no precaution, but if there are symptoms like patient is having any difficulty in passing urine, you should consult a urologist. You have to consult a urologist. If there is bleeding, you have to consult a urologist. If you have recurrent urinary tract infection, you should consult a urologist.
Okay, as you mentioned about the prostate problems and the symptoms and what should we do or not, so what is the treatment to get rid from prostate?
Prostatic enlargement and disease because of the symptoms that are happening to an aging male because of prostate, we can treat it by two ways. First is, our approach is always a conservative one, where we give medication, and most of the persons get relief by medication. So 70 to 80% will have better results with medication, but few of them doesn't respond to medicines. So in those patients, we have to go do endoscopic surgery. So that endoscopic surgery can be done by two ways. One is we do it endoscopic electrically, one that is known as transurethral resection of prostate, and another, the latest one, is laser prostatectomy. With the help of laser, we can remove the whole of the prostate. Okay.
But is it risky?
Beforehand, when we used to do it with help of electricity or TURP, it was risky, but nowadays because of the advent of laser, it is very much less risky.
Okay. So, sir, now would you like to say about the pediatric surgery where people are going through nowadays, we can see?
The pediatric urology is another subspecialty of urology, where we have basically we have kids who have congenital defects. When the baby was in the uterus in his or her mother, then only we can diagnose the disease, the urological diseases. Once he comes up to this wall, then we can treat. Few of the cases I have done operated on a 3 days old baby. So all type of pediatric diseases, but today there may be the congenital defect of the kidney, we can do it endoscopically or laparoscopically, that we can do. But in pediatric urology, laparoscopically we don't do much of the cases because the size of the baby is very small. In those cases, normally we do an open surgery or an endoscopic surgery.
But why does it happen?
It's a congenital defect. It's a defect in the genetics of that baby. So as such, we cannot say that this is happening because of this, but it's because of the genetics.
So after doing that surgery, the child can be
normal. He will be normal. He or she will be absolutely normal.
So there is no risk about
No.
Okay. So sir, आपने mention क्या about kidney stones and उसका क्या क्या precautions है, क्यों होता है और different types of surgery कैसे होता है, but ऐसा एक मानना है हम लोग असमीज community में लोग बोलता है कि अगर हम पेड़ का कोई लीव्स पत्ता अगर खाते हैं तो हम लोग का किडनी स्टोन्स चला जाता है. सो कितना दूर तक ये सही है या जस्ट इट्स अ सेइंग?
See, the thing is that it is what you are saying is dupor tengar pat. Dupor tengar pat जो हम होमियत खाओ जो खाते हैं. The thing is that is an older version. Our grandparents used to say that if you are having pain in the abdomen, you should have dupor tengar pat. Why? Because dupor tengar pat causes diuresis, increase in the urine formation, and with a what you can say, with a thinking that if our urine formation increases, the stone will be flushed out.
Okay.
Yes, that is true for a small stone, but if the size of the stone is bigger and if the kidneys are blocked, then it won't work. It will worsen the condition. Okay. So in what I would say that you can have whatever you want to have. It's not harmful or anything like that, I won't say. But if you are having pain because of kidney stone, once you have to compare a neurologist, you should consult, and after that consulting a neurologist, you can have whatever you want to have.
Okay. Sir, I also want to know that what are the diseases that a urologist actually treat?
Yeah, if you come from above, we treat any diseases that is related to kidneys. As
okay.
For example, most common, I have already told, kidney stones, any cancer in the kidney, any disease that is causing blockage of the kidney, any congenital disease in pediatric age group we treat, any disease of the ureters, that means the urine pipe, any disease of the urinary bladder like urinary bladder stone, urinary bladder tumor, urinary bladder cancer, we treat. Any disease of the prostate like benign enlargement of prostatic cancer, we treat. Any disease of the male reproductive tract, we treat. Male infertility also we treat.
Okay. So if someone faces this problem, so if they want to contact you, so what is the way to contact you?
Yeah, I do my private practice in Macro Hospital, okay. Guwahati, Khanapara, and also I'll be available in Guwahati Medical College.
So sir, what should we do and what we should not, or what should we have and what should we have not do to prevent the kidney stones?
Kidney stones, right.
Yeah.
So first thing that I always say to my patients that once you have kidney stone, the chances of having stone is 30% in next 5 years. And for a normal person also, you should always have 3 liters of water daily.
Okay.
1 glass of any citrus fruit juice, any citrus, it can be Mossambi, it can be a orange, it can be a Nimbu, right? Then you shouldn't take raw salt. Raw salt you should avoid. It has to be cooked, okay? And if you go to the products, kosu, that is yam, that is very famous in our Northeast India. That is one of the cause for increased number of kidney stones in Northeast India population, because it has got highest amount of oxalates. Then second is you should always remove the seeds of tomato. You can have tomato, but you should remove it. So these 2 things, one is yam and another is seeds of tomato, you should completely avoid. And restriction is spinach, cucumber. Everyone says that cucumber has a high water content. So there is a misconception that it helps in removing stones, but the seeds has got high oxalate content. So because of that, the chances of kidney stones is higher.
Okay. What about chilies seeds? Is it good?
Chilies doesn't have anything to do with kidney stones, right? Spinach, cucumber, brinjal, you should avoid. I'm not saying that you have to stop it. You have to stop only yam and seeds of tomatoes.
I want to know when we are feeling for pee, and if in that moment we don't pee at the right time when we are feeling, so if we store it and if we do it in later, so is there any high chances to form kidney stones?
Actually, if you are doing it for once or twice in a day, once or twice as an event, it doesn't affect much, but if you are doing it regularly, it doesn't increases the chances of kidney stones, but it increases the chance of urinary tract infection.
Okay. As we come to the end of our today's program, so we have learned that urology is not only limited to urine problems. Urology covers from urine problems to prostate, from prostate to kidney stones, and from kidney stones to modern technologies or modern surgeries. So at last, what do you want to say to our audience, sir?
Yeah. The urology, what I have seen in my last 15 years of practice, that there are many urological problems in the population. If I consider the Northeast India, the most common urological problem is kidney stones, and because of the kidney stones, I have seen many of the kidneys which have gone non-functioning. That is why I always say everyone that annually you should everyone should have one ultrasound done, so that if the size of the stone is small, we can treat the stone and prevent the kidneys from getting deteriorated. So to protect or to save your kidneys, I advise everyone to have an ultrasound yearly, at least one ultrasound yearly, to prevent kidney stones, as it is very common in our Northeast India.
Okay. And so would you like to say to our young generation who want to become a urologist like you?
Yeah, if you want to become urologist, it's a very fantastic branch. We are doing everything. We are doing the medicine practice. We are doing surgical practice. Even we are doing a radiological practice, because we have many interventions which we do with the help of ultrasound. So it's a very fantastic branch, and the most important part of urology is that we are treating patients with the help of technology. Because now artificial intelligence has come in urology, so we are treating patients with the help of artificial intelligence, and we are treating the patients with the gadgets that other branches are not using. So it's a very precise department, and we are using all types of scientific things, and it's a very fantastic department. Only that I want to say.
So that's all from our today's program. If you are suffering from, or if you want to get rid from urological issues, you can contact Mr. Devanga Sharma. We have given his contact number below in our screen. So do contact. You can get him over Northeast India and for people of Assam. So that's all. Stay healthy, stay happy.